Hello, young friends. Thanks, Rashi, for inviting me and making me this audio video for you people. It's a breast cancer awareness month, but it should be a continuous program, and such a type of awareness is essential for all of us. Let us start from the beginning. We all know that after fertilization of the ovum, the development of embryo starts in uterine life. The various process is simply multiplication of the fertilized egg into 2, 4, 8 and likewise into different layers and organs and tissues and systems and ultimately forming the whole body. So cell division is the basic nature so that the body is developed. So usually what happens is when the body is developed, there are genes in the normal cells which suppress the excessive development or division of the cells leading to tumors. But something goes wrong. The DNA changes that inactivate tumor suppressor genes and can lead to uncontrolled cell growth. And that's how the cancer cell is formed. So one must remember that the cancer cell is our own body cell which starts behaving abnormally, divides uncontrollably and spreads into surrounding tissues. That is what cancer is. Cancer cells can break away from the original tumor and travel through the blood or lymph systems to distant locations in the body where they exit the vessels to form additional tumors. This is called metastasis. And this is the major danger of the cancer because once it spreads to the other organs and other systems, it becomes difficult to remove surgically and it becomes life-threatening. So anything can happen and any organ can be affected. For example, the central nervous system, brain, eye, lungs, liver, pancreas, gastrointestinal tract, that is digestive system, including colon, rectal, stomach, soft tissues, bones, skin, various reproductive organs including uterus, cervical, ovaries, vagina, other genitourinary organs, bladder, kidneys, prostate, testicular, blood, breast, endocrine system, head and neck, nothing is left. So any organ, cell can behave abnormally leading to cancer of that particular organ or the system. Breast and uterine cervical cancers are more common in females, while prostate cancers are more common in males. So depending upon the nature of the original developing cells affected, the cancers are named as carcinoma. A carcinoma begins in the skin or the tissue that covers the surface of internal organs and glands. For example, breast cancer is type of carcinoma. When the tissues and the supporting system or connective tissue of the body is affected. The cancer is called as sarcomas. Leukemias are nothing but the cancer of the blood organ, blood forming cells, which is very dangerous because it is difficult to treat also. Lymphomas are nothing but the lymphatic system cancer. Again, it is widely distributed in the body and difficult to treat, especially surgical intervention is not possible in such a type of cancers. Even there is cancer of skin pigmentation, which is called as melanoma. So, breast cancer is not the only cancer, but other organs can also be affected. Now, cancer is more common, of course, in women, but it rarely occurs in males also. Now, if you look at the breast, its anatomy, there are milk ducts or lactating ducts, then there are lobular glands, and surrounding it there is a connective tissue. So depending upon the type of the particular organ or the part of the breast which is affected, the breast cancer types can be labeled. Ductal breast cancer is where the lacteal or milk ducts are mainly affected. Usually this is called as non-invasive type of cancer because here the chances of release of these cancer cells into the bloodstream are less. If it is detected early, it can be completely curable and the life expectancy is more than 5 years. The other type of the cancers are more dangerous because they come under the category of invasive cancers. Means here the cancer cell can very easily escapes into the bloodstream and leads to metastasis, which we previously seen. So these type of the cancers may become difficult to treat if diagnosed later. If we look at the number, the stats are alarming. 1.38 million new cases of breast cancer are detected every year. In India, one woman dies of breast cancer every 13 minutes, while the detection rate is every 4 minutes one Indian woman is diagnosed with breast cancer. The deaths are also alarming. 4,58,000 deaths occur from breast cancer every year. We all know the pandemic of corona. It was very scary and thank God it's ended now. But during the nationwide lockdown, nearly 80% of breast cancer patients decided to stay back at home by ignoring early symptoms instead of coming to hospitals for screening. That is understood because the hospitals were mainly tackling with the corona patients and it was difficult to get appointments and having the normal checkup easily available. Not only that, but the patients which were already under treatment too suffered, while many of them are now turning up for follow-ups. The loss of time and lack of treatment has led to the spreading of cancer and moved to the advanced stages. So there may be more number of deaths during the coming years because of the pandemic. Now, when cancer is detected, the first question is usually comes to mind is why me? There is no answer for why me because it is more or less decided genetically what will happen to the cell division and how the normal cell is converted into cancer cell. What exactly triggers is not clearly understood until now. When we have the clear answer to those questions, we will be able to control the cancer. But we can say now it may be the destiny and we can sympathize only. But acceptance is the first step. It is the acceptance which is not there, and it is the simplest reason why women do not seek care early, that they do not feel any pain in the breast lump. So they ignore if there is lump also. But in that case, clinical breast examination by a doctor should be done, especially by the women in the age group of 20s and 30s, and every year women aged over 40. So this clinical breast examination will be helpful to detect the early cases of cancer. The ultrasound scan should be made part of an annual health checkup, especially after the age of 40. Adult women with 40 plus age and with family history, that means if they have someone died of cancer, their close relative in the family, then they should perform mammogram at least twice a year. Mammogram is a tool. It is a screening tool. It can be done at any time that uses low dose of X-rays, and it detects any signs of breast cancer at very early stage, even when the lump is too small to feel. This is a life-saving diagnostic tool. If detected earlier, the life expectancy of these patients is usually more than 5 years. Screening mammograms are often less reliable for women under 40 years of age. So they are advised after the age of 40, usually from 50 to 74 years, every 2 years. The density of the breast tissue in younger women often makes it difficult to detect cancers on mammograms. That's the reason why women under 40 years should undergo ultrasound scan and clinical breast examination. If we look at the number of breast cancer cases, 40% of cancers in Indian women are of breast cancer cases. One woman gets diagnosed with breast cancer every 4 minutes in India, and one woman dies of breast cancer every 13 minutes, making it the most prevalent cancer among women. Though these are only numbers, that is 14%, so I may not be in between the 14%, but remember always that for that particular family, for that particular individual, the presence of disease is always 100%. The cancer survival becomes more difficult in higher stages of its growth, and more than 50% of Indian women suffer from stage 3 and 4 of breast cancer. Now, these are the stages when the cancer cell enters into the bloodstream and escapes to the other organs, forming metastasis, and the secondary organs are affected and more number of organs become cancerous. If it invades the vital organs, it leads to death. 50% of breast cancer patients first visit the doctor when they are in stage 3, and 15 to 20% of patients visit when they are in phase 4. That is the scenario in India. So that's why we need to make aware about the presence of breast cancer. Remember, in early stages, it is completely curable. Post-cancer survival for women with breast cancer was reported 60% for Indian women as compared to 80% in the US. And that is mainly because the Indian women do not reach to the doctors as early as possible. As we often say, there is no sufficient knowledge on the causes of breast cancer. Why? What leads to breast cancer? There are various factors which say that smoking, alcoholism, overweight, hormonal therapy, etc. predispose the cancer. It's true when it is compared with the non-smokers, non-alcoholic or the non-obese patients. But this doesn't mean that it will not happen in any normal individual. So, the early detection of the disease remains the cornerstone of breast cancer control. Early detection, availability of adequate diagnosis and treatment, if available, that is the main clause in India, there is good chance that breast cancer can be cured. Late detection, however, curative treatment is often no longer an option, because surgical removal of the breast is the major first line treatment. Unfortunately, breast and hair, these are the two sexual characters, are considered the points of beauty of an woman. And because the surgical treatment removes the breast, many times women are reluctant to undergo the treatment, and that leads to the fast development of the late stages of cancer. And in late detected stage 3 or 4 or later stages, when cancer spreads to other body parts other than the breast, palliative care remains the only option, because the surgical option is no more there. Chemotherapy is also have limited effect, and only option remains is the palliative care to relieve the suffering of the patients and their families. So always remember that the early detection of the disease remains the cornerstone of breast cancer control. Don't be afraid of the surgical intervention. Now, how to detect earlier? It's very simple. One can self-examine, and that should be done by the individual of all adult women at all ages at least a month. It can be done in the shower or in front of a mirror. With the pads or flats of your 3 middle fingers, check the entire breast and armpit area, pressing down with light, medium and firm pressure. Check both breasts each month, feeling for any lump, thickening, hardened knot or any other breast changes. Visually, one can inspect the breast with its arm at your sides. Next, raise your arms high overhead. Look for any changes in the contour, any swelling or dimpling of the skin or changes in the nipples. Next, rest your palms on your hips and press firmly to flex your chest muscles. Left and right breast will not exactly match. Few women's breasts do, so don't worry. But look for any dimpling, puckering or changes, particularly on one side. The third method is in lying down position. When lying down, the breast tissue spreads out evenly along the chest wall. Place a pillow under your right shoulder and your right arm behind your head. Using your left hand, move the pads of your fingers around your right breast gently, covering the entire breast area and armpit. Use light, medium and firm pressure. Squeeze the nipple. Check for discharge and lumps. Repeat these steps for your left breast. If you find a lump, immediately schedule an appointment with your doctor. But don't panic. 8 out of 10 lumps are not cancerous. For additional peace of mind, call your doctor whenever you have concerns. And this is the most important thing. Self-examination and be breast aware. Now, the symptoms of cancer may include what we were looking for the breast examination is there may be swelling of breast, which one breast is suddenly larger than the other. In the neighboring picture, you can see the enlargement of the breast. The breast feels warm to touch and may look infected as compared to the other breast. There may be itching or shooting pain. A dimpling of the breast skin that looks like an orange peel. So there may be some dots and the roughness of the skin. There is thickening of the skin. Then the nipple may be flattened or discolored, or it may be inverted. There may be swelling in the underarm or only on one side of neck as compared to other side. You might feel lump. However, lumps are not common in IBC, that is one type of the breast cancer. Now, There are various stages. We were always talking about the early stage and later stage and likewise. So there are stages from 0 to 4. The stage 0 is where the cancers are limited to the inside of the milk duct and are non-invasive. That means they do not spread to the other tissues, and this is completely curable. In stage 1, if it is not treated in the stage 0, it may lead to stage 1. These breast cancers are still relatively small and either have not spread to the lymph nodes or have only a tiny area of cancer spread in the sentinel lymph node. That is the first lymph node to which cancer is likely to spread. And as I have told you, the lymphatic system is the type of circulatory system which is spread throughout the body. It collects the fluid from the extracellular spaces and returns the blood after filtering into the general circulation. So that fluid which is collected in the lymphatic system is called as lymph, and the filtration of lymph occurs in the lymph nodes. We know tonsils. Tonsil is one of the lymph nodes. The second stage is the breast cancers are larger than stage 1 cancers, and they may be spread to few nearby lymph nodes. These lymph nodes, they try to restrict the cells, any cells, microorganisms, the dead cells or even the cancer cells, and try to kill them by protecting the spread of infection to the other parts of the body. That's why when there is common cold, you will find the tonsils are little bit enlarged. So, but in this case, the lymph nodes are not able to stop the spread of the cancer cells, and the cancer cells escape through the lymph nodes, through the lymph system, and spread to the other nearby organs, leading to stage 3. These tumors are larger and are growing into nearby tissues, the skin over the breast or the muscle underneath. Now they are affected and they have spread to many nearby lymph nodes. So here one has to surgically remove the complete breast in such a cases, but there is always a chance of spreading of the cancer cells already to the other parts of the body other than the breast. Now for the treatment for stages 1 to 3 includes usually surgery and radiation therapy, often with chemo or other drug therapies either before or after the surgery. So surgery is the main line of or first line of treatment in breast cancer. It is the main treatment for stage 1 breast cancer. These cancers can be treated with either conserving the breast during the surgery, sometimes called as lumpectomy or partial mastectomy, or complete removal of the breast, that is mastectomy. In case of stage 4 or metastatic breast cancer, the cancer is already spread beyond the breast and nearby lymph nodes and the other parts of the body, making the surgical treatment impossible. So if we look at the type of the cancer and its treatment, you can see surgery is the first line of treatment, followed by radiation therapy. Of course, after surgery, radiation therapy is essential. It is a localized target for that particular killing of the cancer cells. Then chemotherapy, we are not going into details which drugs are there or what are they, but when the cancer is treated using the drugs, we call it as the chemotherapy. Then there is immunotherapy depending upon the type of the cancer. There is hormone therapy depending again upon the type of the cancer. Then there is a targeted therapy and stem cell therapy, which are some of the new therapies which we think that we are controlling the faster recovery and less number of side effects. Now, what is stem cell therapy? The stem cells are nothing but the basic cells which we have seen during the formation of the embryo. That is, it is any cell which gets converted into a different function and structure according to the type of the organ. So we are thinking about the stem cell therapy. It is a new branch and still under research. The major problem in any cancer patient is, first, it's a psychological trauma for the family as well as for the patient. Always there is a question, why me? Then the life expectancy is very, very less. So the patient starts looking at that the death, you can say that death is approaching, and that is a very scary feeling for the patient as well as the family. Then there is a financial burden, because unfortunately all these therapies are very costly, because they are highly specialized therapies and they should be given under medical supervision. So what remains is, along with the actual treatment, the patient requires support from family, friends, and the society. So this caregiving support, if we wish to do, always remember that can be rewarding as well as stressful, because you are looking at the death. There are various caregiver support groups in India. They work in different fashion. There are physical or in-person support groups which hold regular meetings at a designated place. These are the few groups which are listed on the net: Caregiver Sathi, Adveka Foundations, Institute of Psychological Health, that is IPH Pune. But of course their scope is limited and they are designated to the specific places where they are working. But you can form the caregiving support groups anywhere in your area, because either in physical or online support groups form. The patient wants to listen, he wants to relieve stress, he wants joy, he wants financial support, and of course physical, emotional and financial support is required by cancer patients. So simply what we can do is, if some of our friend is suffering from cancer, we can link them up, send a card, note or text to say you are thinking of them. So at least that can be done. Now, why patients or the family members are very wary about the chemotherapy? Because there are n number of side effects, and these side effects are because we are targeting our own body cells. Though these are cancerous cells, always remember that these are our body cells. So when we try to kill the cancer cells, the drug also kills our own normal cells, and that effect is prominently seen where the cells are continuously developing and they are growing because of wear and tear phenomenon. So the common side effects are nausea, vomiting, diarrhea, and loss of appetite. This loss of appetite or the anorexia, that is, the patient doesn't feel like eating, and because of that it leads to fatigue and loss of weight. So that is the major problem with the cancer patients, because it is the side effect of the drug. Then there may be fever, there may be mouth sores, pain, constipation, easy bruising, bleeding, and so on. But out of all these, one more side effect is very alarming for the patient, and that is hair loss. So all the body hair are lost. That is called as alopecia, falling of the hair, leading to the baldness of the head. As we said earlier, breast and hair are some of the beauty points of a woman, and this hair loss is causing lots of stress as far as the patient is concerned, though it is very harmless. And when the patient recovers, there will be again regrowth of the hair. But apart from these, there are some long-lasting and late-developing side effects. There may be damage to lung tissues, because these are again some of the developing tissues. There may be heart problem, there may be infertility, there may be kidney problems, there is nerve damage, and always there is risk of second cancer. After some years, there may be recurrence of the cancer, and that is, no one is going to tell anything about this. So why be aware? Because most of the cancer patients wish to be well informed at all stages of their cancer journeys. They want to know what is happening with me. They want information about their care, what is going to happen, what is the chemotherapy, what is the surgical removal, what are the after effects, how I am going to cope up with this. And this receiving valued information is very strongly related to satisfaction with that care. And mostly we hide the information from the patient, and that creates more stress for that particular patient. So information seeking behavior continues from diagnosis to follow-up. And if we know what happens exactly beforehand, we can reduce lot of stress, and we will be able to handle the situation more easily. So be aware and help. Thanks for being with me, and thanks again for inviting me for communicating with you all. Thanks.